Well, we've all heard of dry January, right? But what about sober October? You stay away from alcohol for 31 days straight to cleanse before the holidays. So here to talk about the trend, Dr. Joseph Volpicelli. He's the executive director of the Institute of Addiction Medicine. Dr. Volpicelli, thanks for being here with us.
Thank you.
So
happy to be here.
We see a lot of people doing these stay sober trends, especially we were talking about January, now October. What are some of the biggest benefits you see in patients who decide to do sober October?
Yeah, so this is a really good time for people to sort of reassess their relationship with alcohol. And many people find that taking 30 days off of drinking no alcohol at all, or at least cutting down on the number of binges, heavy drinking days, has really a lot of important health benefits. It's healthy in terms of your psychological health. People report less anxiety, less depression, improved energy, improved sleep. It has important physical effects. It helps you with weight loss. It helps you with even your skin becomes less dehydrated. You get less wrinkles, lowers your cholesterol, lowers your blood pressure. And particularly as you get older, less risk of having falls and fractures. And it also helps improve social relationships. People have more fun to do enjoyable activities and be with loved ones. So it's a really good time to sort of reassess your relationship with alcohol and see if it's a problem for you.
Yeah, a lot of great benefits. What about those who don't think that, they have a problem with alcohol, those who kind of only drink in social settings? Would they still see those types of benefits, or if you're only drinking a couple of times a month anyways, maybe not so much?
Exactly. So even if you just cut back, research shows that has important health benefits, just cutting back. So if you're a male, you shouldn't have more than, say, 5 drinks in one setting. And if you're a female, no more than 4 drinks. And if you cut back on those binges, that should show important health benefits. So even if people don't want to completely stop drinking, it's still helpful to cut back on those heavy drinking days.
What should someone know before taking on this trend? Is there anything they need to prep ahead of time?
There's not much to prep. Sometimes it's helpful if you do it in a social context. So if you have people that you're doing it with, that can help improve your motivation to stay on it. Now, people who are physically dependent on alcohol, if you were to quit all at once, could bring on withdrawal symptoms. So if you have a problem where you're physically dependent, you need to be careful if you're going to stop drinking altogether. That should be done under medical supervision.
Right. All right. Well, Dr. Volpicelli, thanks for being here today and providing that insight on a new term that we learned today with October and not drinking. Thank you. We appreciate it.
Thank you. Thank you very much.